Hi, Mrs. Johnson. I'm back with the supplies to start your tube feeding with your NG. I got the supplies, everyone. I got the tube feeding bag to put the tube feeding cans here. I got Javity 2 cans, 1.2. I also have a pair of gloves. They don't have to be sterile, clean or fine. I got the Toomey syringe, 60 milliliter. I got the label. I got to label the bag, you know, the patient's name, room number, and all that. I'll talk about that. I need a cup of water to flush the tube feeding before and after the feeding. I need a tape. The tape it goes on the side of the bag, so I keep track. You know, I come in 2 hours. Is it infusing? How much is supposed to? I put the times on it. I need the stethoscope to make sure to check the tube feeding or the NG tube is in place. It's in the right place, okay? And also to protect the beds, you know, when I'm infusing, so I'm not spilling on the patient's bed. So I have doctor's orders here. You always want to make sure to check the doctor's orders. So the doctor's order said that continuous tube feeding, Javity 1.2 at 50 milliliter per hour, using the nasogastric tube, so because it could be PEG tube. So for her, it's a nasogastric tube. It has to be on at 9 a.m. and it has to be off at 2 p.m. And then make sure to flush the tube feeding, the doctor order said, before and after using 15 to 30 milliliter of water. Okay, so what I'm going to do is I'm going to take my bag. I'm going to make sure the clamp is closed, because sometimes some of the tubing, it might not be self-locked, because this one's not going to leak. So I'm going to close the clamp. I'm going to put it in the bag, 2 cans of this. Now, I already have prepared, you know, I already put the 2 cans of Javity. Okay, this was just to show you how it works. Okay, so once I put the cans of Javity in the bag, I have to label it, you know, that's very important. So I put the patient's name, I put the room number, the date, I'm hanging the tube feeding, the time is 9 a.m. Because it's on 9 a.m. and off at 2 p.m. So the time is 9 a.m. Rate is 50 milliliter per hour. Formula, I'm going to write Javity 1.2. And I'm also going to put how much total I'm putting. So here we have, so total I'm putting 200, actually it's 2 cans, 500 milliliter, and the time is 9 a.m. and my initial, okay? So that will go on the bag, so everybody knows what's going and when was it hung. Okay, so every time we give tube feeding, we got to make sure we check the abdomen, you know, assessment, and also if the tube is in place. So I'm going to put the gloves on. Okay, Mrs. Johnson, what I'm going to do right now is I'm just going to check your abdomen and also check there's bowel sounds present. Okay, so I'm going to check, I'm just going to look. Okay, it's not distended. It's nice and soft. Okay, I don't feel any nodules, anything. And it's non-tender, no pain. Okay, now I'm going to listen to bowel sounds. I'm going to listen to hypo or hyper bowel sounds. Hyperactive, I mean. So I'm going to listen to bowel sound, all 4 quadrants. And she got good bowel sounds. Okay. Okay, next what I'm going to do is I am going to check if the NG is in place. So I'm going to take 15 to 30 milliliter of air. Now, I can pinch the tube here so the air doesn't get in there. Okay, so 15 milliliter is enough. Okay, so at the same time I put the stethoscope epigastric region. At the same time I put air in, I listen for gurgling sound in the stomach. And I hear the gurgling sound. Okay, I pinch the tube again. Now, if you don't hear the gurgling sounds, that means the tube is not in place. Another way to check if the tube feeding is in, the NG tube is in the stomach is to withdraw gastric content. So I'm going to withdraw gastric content. And Jean here, she's going to check the pH of the gastric content for me. Okay, Jean, can you go check the gastric content for me? Okay. Okay, so Jean said the gastric content is 4.1. We want 4.1, and that's gastric content, so the NG tube is in place. So those are two ways to make sure the NG is in place. Okay, very good. So I always want to, clamp the NG. All right. Okay. I should have put this before there, so I don't, I keep the bed sheets clean in case I spill something. Okay, so I already have my 2 feet bag already set, 2 cans of Javity. Okay, I hang that. Now you also need I didn't say that, kangaroo pump to do the continuous feeding. This is a kangaroo pump. Okay, so I already marked everything, patient's room number and everything, and I'm gonna label the bag so everybody knows patient's name, what formula is in there. Okay. All right, so I'm gonna put the tubing in. Okay, so this is how you use the kangaroo pump. I'm gonna put it like this, and then I go like that, and this little black thing here, it goes up here like that. Okay, and then the tubing comes like that. There you go. So it's like this and like that. Okay, very good. Okay, so now I'm going to turn it on and set it at 50 milliliter per hour, my Javity. So I'm going to turn the pump on. Okay, so this is a start button here, and this plus and minus, it gives me the rate. So if I press the plus number, it gives me, how much rate I want. If I go down, the number go down. If I go up, the number goes up. So I want 50 milliliter. So I want 50 milliliter per hour. So I'm going to set it at 50. Okay, it's all set. The clamp is open. So now I'm going to connect it to the NG tube. Okay, it's all set, Mrs. Johnson. All right, I connect the tube. Actually, you know what? Something I forgot to do. I need to flush the tube feeding. I can't just start the tube feeding, right? Okay. So the doctor said to flush the tube feeding using 15 to 30 milliliter water. So I need to flush it, make sure it's clear, and the fluid is running. So I'm going to measure 50 milliliter in this syringe. Okay. So I'm going to put 50. Here's my 50 milliliter of water, flushing the tube. Okay, and you let it go by gravity. You don't use the plunger. You do not push. Okay, it's going by gravity, and that's also how you feed the bolus feeding, which we'll show you later. All right. So now we're ready to feed. You gotta make sure you flush the tube before you hand the tube feeding Javity. And here we have it. I connected it. Okay. And now I go back to the pump, and all I do is turn it on. Oh, it's already on. I'm sorry. So I just start it. So here the 50 milliliter is infusing now. And that's how you do the continuous tube feeding.